Hello and welcome to Heart of the Matter, a broadcast series where survivors come on and share their story, inspiring us to overcome health problems. I want to remind everyone that heart disease is the number one killer of women, taking the lives of 1 in 4. I also want to talk about colon cancer. 137,000 people are diagnosed with colon cancer each year, and annually 50,000 die from colon cancer. I give you these statistics because my guest today is a survivor of both. I'm so pleased to have with me today my heart sister and friend, Dawn Blatt. Dawn is going to tell us her story and answer some questions for me, but first I'm going to introduce her and tell you a little bit about her. Dawn is a wife, mother, grandmother-to-be, daughter, sister, friend, physical therapist, college professor, and survivor of heart attack and colon cancer. She's celebrating her 9th-year anniversary of her heart attack. She's been married for 32 years. Her children are grown, and she and her husband enjoy being outdoors, walking and hiking, dining out, visiting wineries, enjoying sunset on the beach. She loves exploring New York City and attending Broadway shows. Please help me welcome my friend, Dawn Blatt. Welcome, Dawn.
Hi, Susan. Thank you for inviting me.
You're welcome. Let me say one more thing. I'm Susan Smith, your host, and Dawn is speaking to us today from Long Island, outside of New York City. So I'm so happy you're here. I'm going to have you answer some questions, but before we get into that, would you tell us your heart story, Dawn?
Sure. My heart story starts on February 20th, 2012. As you said, I'm coming up on 9 years. I was in California. It was my first day of vacation with my family. We were out there to do some sightseeing and visit my son, who was a freshman in college. And the first day I was out walking with my sister and started feeling some chest pressure that I'd never felt before. But I didn't say anything because I don't want to ruin anybody's vacation. And after about 20 minutes, it went away. So I thought, all right, let me get that checked out when I come back home because it's something that's not normal. But I moved on. About 2 hours later, I was in my hotel room and that chest pressure came back. It became more intense. It started radiating down my left arm and I was getting anxious. And I started pacing around the hotel room a little bit and it was intensifying. So finally I said to my husband, we need to find a hospital. I need to get checked out because something's not right. So I went to the elevator and was hitting the button, waiting for him, and he wasn't showing up. So I went back into the room and said, what's going on? And he said, we're not driving to the hospital. I called 911. So I must have looked really bad. And he did the right thing by calling 911. The paramedics came and in the hotel room started monitoring my vital signs and EKG and talking about changes in my EKG, which I know are consistent with a heart attack. I'm used to being the person on the other side of the bed as a physical therapist, but in my head, I thought, I'm not having a heart attack. I don't know why they're talking about EKG changes. So I went to the hospital and the doctors did blood work and were telling me, okay, we need to admit you. And tomorrow we're going to do a cardiac catheterization. So at that point I said, well, then you'll be able to tell me if I had a heart attack. And he said, oh no, you had a heart attack. So that denial was gone. I had to face the reality that I was having a heart attack. And the next morning they did the cardiac catheterization and placed one stent in my LAD, one of the arteries, the larger arteries in the heart. I had the Widowmaker heart attack and I was 46 years old. I had no prior signs and symptoms. I had no significant risk factors. So this came from out of the blue and really took me by surprise. So vacation was over and after staying in California a few days, I was cleared to fly and came home. I was still having symptoms in my left arm. So when I started with the cardiologist, That first visit, as he heard my symptoms, he sent me right to the ER on Long Island, where I was had another cardiac catheterization and 4 more stents placed in the LAD artery. So I think that artery is stented the whole way. I was then cleared to go home, and after 2 months was cleared to go to cardiac rehab, which I feel was so important in my recovery. It allowed me to gain confidence in my body. I was really nervous to do anything exercise wise. So cardiac rehab was a really big part of my recovery, not only physically but mentally. At that point, I was also able to go back to work, and I have minimal heart damage, so I was fortunate, and I can pretty much do any activity that I want. So I feel really fortunate about that. My heart story continued to evolve in that a couple of years ago when I was at a Women Heart conference, I was talking to one of the other Women Heart champions, and we share our stories. And my story never fully made sense. I was 46 years old. The doctor said the one artery where the stents were had a lot of plaque. The other 2 arteries were clear. So this didn't fully make sense. And so my friend said, you should be checked. Have you ever been evaluated for something called SCAD, spontaneous coronary artery dissection? And I've heard of it, but it never crossed my mind that it could be part of my story. And so Mayo Clinic in Rochester, Minnesota is gathering information on and creating a big database to study this syndrome, SCAD, or this pathology. When we can travel again, I plan on going. They have a full evaluation, but it seems like my story fits. And I did send my my cardiac catheterization films, and they did say that my heart attack was caused by SCAD. So it was a piece of the puzzle that fell into place a little bit later. So I want to go to the Mayo Clinic to learn more, and they do other testing as well for other conditions that are associated with SCAD. So that's my story.
Yeah. Well, you've triggered a question for me. How much time passed between your first and second incident and then the SCAD realization? Was it a year or 2 or some months or?
Years. It was probably 4 years, give or
I
take.
see.
Yeah.
Interesting. So as I understand it, SCAD is when a piece of the artery tears away and that flap clogs the artery.
Yes.
So it's not like a plaque clog, but it's just and that. So stop me before I give it wrong. Is that correct?
Yes. And it is something that they're not sure the etiology, why this happens. They have found that it primarily occurs in women. It tends to occur in women who are younger, and especially after childbirth. Now, that wasn't part of my story, but it does affect younger women as well. So it's a different reason for a heart attack as opposed to the plaque buildup.
I understand. Wow. That is something. And as you say, the mystery is getting solved. A piece of the puzzle now fits in. I appreciate that so much. Let me ask you a few questions.
Mm-hmm.
So after you had, I'll say after the second incident, had all the stents put in, did you have an emotional reaction? Any emotions around this?
Yes. Initially, it was just shock that I had had a heart attack. Even just saying those words were really difficult. And the doctor, I cried probably every day for months, and any time I would talk to somebody, I would get really upset. And the doctor said, it's like a PTSD. It was very traumatic to have had the heart attack. And so I was trying to make sense of it. I also had some anger along the way. At each time, whether I was in the hospital or seeing different healthcare providers, they'd say, "Oh, you were so young. You would have had a heart attack at 46." And yes, I did. And, I was not too young. I did have a heart attack. So that felt like to me wasn't helpful. And from what I've learned, women at all ages have heart attacks. So there's not oh, you're too young. So that was part of it.
And I think that anger thing, the reason I talk about emotions in this broadcast is I want people to know how normal it is to have these emotions and to be angry and to be in disbelief and to cry and be in shock
Yeah.
because this is a major traumatic thing that's happened, and that's how our body and our psychics react. Um, and anger is very common, and I can only imagine you hearing that, and they're talking about you being too young, and you're going, "But I had it. I had a heart attack."
Hmm.
So, did you make any lifestyle changes after you had your heart attack?
I did. I changed my diet. I eat low sodium. I try to eat higher fiber, lower carbohydrates, and I make a concerted effort to exercise on a more regular basis. But I consider myself a work in progress. I'm really good for a while, and then then it's winter and it's hard to be outside, or I can rationalize anything. But it is something that I make a conscious effort to try to be more physically active. Although even just before my heart attack, I think back and I was on the treadmill in my basement and I was pushing myself and had no symptoms. So, I continue to try to, live as heart healthy a life as I can.
Good for you. That's great. So, what did you learn about yourself after your diagnosis? What did you learn about you?
Well, as I said first, going to cardiac rehab was really helpful for me to learn to trust my body. It almost felt like, you were betrayed or that, you couldn't do what you wanted to do. So that was helpful. Something also that was really helpful for me was learning the importance of peer support. So my family and friends are very supportive and were there for me from my heart attack on and even now. But there's something different about connecting with another person, especially a woman who has heart disease and who's living the same kind of life or has those same thoughts. And it doesn't even have to be somebody who's had a heart attack. But after I had my heart attack, um, it was hard, that recovery I had, after I had the heart attack and I had the cardiac catheterization, I was in shock and I came home and that next cardiac catheterization was maybe a week and a half or 2 weeks later. I felt like when I came home, I felt more of the mental stress from this. So when I was looking around, I thought I really need support. So that's when I found Women Heart
Mhm.
online, the National Organization for Women with Heart Disease. And I was able to make those connections, and sharing my story with them helped to support me. And then from there moving forward, I've been able to help support other women who either are newly diagnosed or are living with heart disease. I share my story. I hope to raise awareness about heart disease in women, especially how women have different symptoms during a heart attack. So I was fortunate. I had the typical chest pain, pressure going down my left arm that I couldn't ignore. I had to go to the emergency room. But I think that if I was having those more diffuse symptoms, the fatigue, the nausea, anxiety, that I probably would have pushed it off and ignored it. So for me, having those classic symptoms made me seek the medical attention that I needed. And time is really important during a heart attack. So I think I had minimal damage to my heart, partially because of that push to get to the emergency room.
Oh, Dawn, you're so right about that. I'm, I do have one final question, and
Okay.
I'm curious, what is your advice to women about heart disease?
So my advice would be to listen to your body. I wonder if before my heart attack, I had some symptoms that I ignored. I was working, I was running around with my kids, and maybe did I miss something that I should have paid attention to? I want women to be aware that heart disease can affect you at any age, and you can have a heart attack at any age. Heart disease isn't the old man's disease anymore. As you mentioned in the beginning, it's the number one killer of both men and women. So I think we need to be aware of signs and symptoms and ways that we can make changes to minimize our risk factors.
That's so true. That's such excellent advice, and I thank you for sharing that. Dawn, I'm so pleased that you would come on today and share your story. It's very inspiring. And thank you for all your tips and what you learned and the things that you did after your heart attack. We have a minute left, and I didn't touch on the colon cancer. How long after your heart attack were you diagnosed with that?
I was diagnosed with colon cancer in 2016, so it was 4 years later.
My gosh.
Yeah, and it was discovered during my first colonoscopy, a screening colonoscopy. Again, I had no symptoms or signs of that anything was an issue, but I was 51. So how many times do the doctors ask you after 50, did you have a colonoscopy? So I finally went and was diagnosed with stage 3 colon cancer.
Wow. Well, you are really a warrior, especially for this cause, a great heart sister and a great advocate of women and heart disease. So thank you again for coming on today. And I just can't thank you enough. So I'm going to sign off for now to the audience, but if you stay there for a moment, Dawn, we can talk afterwards. So thank you, everyone, for coming on and watching. And until then, I'll see you on the next broadcast. Bye.
Thank you.